Welcome to Tiju's Academy Writing Live with Jansi. So, today we are discussing about basics of writing letter. So, it is very essential to know about the writing in IELTS. So, we can wait for some more others to join us. Hello, good evening. So this is Writing Live with with Jansi. So we can move on our writing types. So it is very essential to know about the writing letters type. So what do you know about writing letter type? Good afternoon, Yogesh. Okay, let's start our live section. So, today I am going to discuss about the basics of IELTS writing in IELTS. So, type of letters. How you know about noun case and unknown case in writing? Hi, Jasmine. Oh, Jasmine. Then, okay, so let me continue with the writing letters. So it is very important to know about the writing letters and type of letters in IELTS when we see the case noun. So it can be a noun case or unknown case. So it can be divided into three parts, like referral letter, transfer letter, discharge letter. Other than this, we can include one more letters in this IELTS writing, that is urgent letter. So when we see a case note, how you will identify a type of letters? So, what is noun case? So, how to identify the noun case in writing letter when you see a writing task? So, if reader known social and past medical history of the patient, or if reader and the patient have same address, so it can be a noun case. Other than this, if patients return back to same nursing home or geriatric home, it can be a noun case. Other than this, if patients return to the same community nurse who gave home visit for patient. Other than this, if you are finding out an IELTS writing task, patients or his or her GP or any job roles, it also can be a noun case. So could you please tell me that how you identify a noun case? Hi Roshlin Raj, good evening. So welcome to Tiju's Academy live session. Hi Adira. So we are discussing about the basics of IELTS writing letters. And what are the type of letters in IELTS? So we can continue with IELTS concept of noun case. So if before moving further, I would like to tell you some important points or story regarding this. So to identify the concept of the noun case, and in first point I was mentioned that all the family doctors are not noun case. So how you will find out family doctors are noun or unknown case? I can tell you a story regarding this. So Mr. X was admitted to hospital with a severe abdominal pain, and his reports revealed ruptured appendicitis. Therefore, he was underwent the surgery, and during hospitalization, he was managed with medication and antibiotic. And currently, he has made good progress in his discharge also. So, after some years, he returned back to his home, and on that day, the family doctors also presented in home. So, whether the family doctor is aware of his appendicitis and surgery, it was an emergency, or he was managed with some medications, all the details will the family doctor know or not know. So, could you please tell me that? Anyone can comment? Hi Aisha, okay. That you comment as a non-case. So, could you please tell me that all the family doctor is a non-case? No, I don't think so. All the family doctors can be a non-case. But if, as I mentioned, that non-case criteria, if the patient know and the reader know about the patient's social and past medical history, then it can be a non-case. Obviously, if the doctor know about the past medical and social history of the patient, then it will be a non-case. I meant to say that all the family doctors are not non-case. I hope you are getting my point. So, second part, if it is mentioned as patient's or her GP or any job roles, then it will be a non-case. And we can move to our separate type of letters, like as I mentioned, that referral, transfer, discharge. And additionally, I have added one more letter, urgent letter. So, referral letter, it is surely I can say that it is 100% unknown case. Next, transfer letter. If transferring to the same hospital facility, it will be known, or if transferring to another hospital, it will be unknown. And discharge letter, if discharging to the same home or rehabilitation or any nursing home or any centers, it will be a no. Or if discharging to new or another hospital, rehabilitation center or nursing home, it will be unknown case. So I hope you are clear about the type of letter and how to identify known and unknown cases in these letters. Then moving to the other slide, we can discuss about the type of letters. I have given some examples also, we can see that. So in case if it is a referral letter, as I mentioned that it is 100% unknown case. So, introducing the patient for the first time, reader does not know the patient before, then it is unknown case. So, we can move to some examples as I mentioned in the note. So, you are a registered nurse in hospital where Mr. Harold Jennings has been receiving treatment after experiencing a stroke. He is now ready to be discharged with a plan for home visit from a stroke care nurse. So patient name was given Mr. Harold Jennings, date of birth also was given as 3/3/1915, age was given as 73. So in addition, I would like to ask some question. If they are given date of birth and the age, which would you like to choose in IELTS writing? Please comment in below. Okay, we can move forward. So if the letters are given date of birth and age, we can go with the date of birth rather than choosing age. So, other than this, in this letter, we are seeing that admission date of the patient and discharge age, which is 15 November 2023 and discharge is 20 November 2023. Charlie's asked meant that age is good. No dear, I suggest you to go with the date of birth because date of birth is very important and we can write the date of birth in this OET writing rather than going with age. Jishai's right date of birth we can go. Nikita, DOB, okay, date of birth it is good. Hi Jitu, good afternoon. So we can move further. Writing task. Using the informations in the case note, including the patient's unique interest, write a referral letter to Miss Engel Foster, Stock Care Nurse, Rubaito Stock Recovery Center. So the address was given in this. So there are mentioned that Mr. Jan's current medical condition, rehabilitation progress, and requirements for ongoing stock specific care. So in this writing task, we can see that write a referral letter to Miss Angela Foster. So they already given the name. They already mentioned that it is a referral letter. If your writing task is given, it is a referral letter, we can go with that. As per the criteria also, if the patients and readers address or residence is different, it is definitely a referral letter, or the reader name is address is correct or same in patient and reader, so we can go as a non-case. Hi Jisha, good afternoon. So we are talking about the basis of OET writing. So it is very essential for those who are starting OET and they are practicing daily basis for the writing module. So it is very essential for them to set a base to identify the known and unknown case and the different type of letters. So in this first example, as I mentioned that it is a referral letter. So according to this, we are identify that this is a referral letter. Next we can move on to the another example for referral letter. You are a registered nurse in the hospital where Mr. Haringenis has been receiving treatment after experiencing stroke. He is now ready to be discharged with a plan for home visit. So this is the same criteria as I mentioned, the same patient name is same and age also is the same. So in this also, we are writing a letter to Mr. Thomas Green, write a referral letter to Mr. Thomas Green, discharge nurse, Sunshine Home Care Services. So it is totally different case. And we are writing as a referral letter. We can move further. Patient is shifting from the hospital, one hospital to another, one department to another department, one facility to another facility. So it is a transfer letter. It can be a known or unknown case. They are given the details about the patients like a name, date of birth, marital status, family, social history, medication, admission details, admission date and all. So, in writing task, using the information in the case note, write a transfer letter to Miss Laura Mercer, Nursing Unit Manager. So address was also given. In this, we can say that it is a transfer letter. So through this we are identifying it is a transfer, referral letter or any other type of letters. I hope you are getting my point. Next Miss Janet Green is a 52-year-old diagnosed with advanced pancreatic cancer and is currently under the care of Hilton Regional Hospital. So the patient is transferring to the one another to a tertiary care centers with a better facility for the complex cancer management. The patient details also is given in this. So we can see that patient name, age, admission date, transfer date. So they are mentioned the transfer date also. So in this criteria, see they are mentioned the transfer date. So 27 April 2023. And reason for transfer, advanced stage 4 cancer, pancreatic cancer, requires specialized oncological care. In writing task, using the information in the case note, write a transfer letter to the admission officer at the Pancreatic Cancer Center of Excellence and address part is given. So they are asked for her admission for immediate specialized care. So in this writing task, they also mention that it is a transfer letter. Hi Dinda. Yes, we can move to our discharge letter. So it is known or unknown case. The hospital details are given and patient details are given and bracket masses and age, marital status, nick of kind, admission date, discharge date also mentioned in this. Diagnosis acute cholecystitis. Using the information given in the case note, write a discharge letter to Mrs. Emily Nagans, general practitioner. So it is given as Mrs. Nagans, general practitioner. So we are transferring the patient, right? So it also a noun case. As I mentioned that it can be a noun case or unknown case. See, they are mentioned that Mrs. Emily Nagans, general practitioner. As I told that to identify some noun cases, there are certain criteria like if they are mentioned in the writing task, patient or his or her general practitioner or any job roles, we can identify this as noun case. And in this, we are identified it is a discharge letter and along with the noun case. So, next, move on to another example. Hello Jitu and Jisha. As you mentioned, that's a noun case. Yes dear, that is a noun case. And assume that today's date is 15 September 2023. You are a nurse at Greenfield Community Hospital responsible for the care of a patient who was admitted for her surgery and is now ready to be discharged. And patient details are given in this like here, name, date of birth, and in that mention also age. So as I mentioned you before, it is preferred to choose date of birth if it is given in the case card along with age. And address also in this they are mentioned that. And we can move further. In writing task, using the information provided in the case note, write a letter of discharge to Mr. Daniel Smith, the cardiac rehabilitation coordinator at the Greenfield Community Hospital. So they also mentioned that briefly outline Mrs. Turner's history, progress, and your concerns and recommendations. So we can see the first line of the letter using the information provided in the case note. Write a letter of discharge to Mr. Daniel Smith. So they are mentioned that it is a discharge letter. So hope you understand all the informations Do you have any concerns regarding the known case and unknown case and how to identify the type of letter? So I suggest you to mention all the type of letters which is exactly mentioned in the case cards. If it is a referral, kindly go with the referral letter and try to understand in different cases like a discharge and transfer, try to understand the known and unknown cases especially. So totally the referral letter is under percentagely unknown cases. So please write the letter as referral. You have any concerns regarding the type of letters? So once again I can tell you that we are discussed about the basics of letter. It is very helpful to identify and set the base of OET writing in OET module. So once again I will tell you about the type of letters. It can be a noun case or unknown case. We can divide it into separate criteria under like referral letter, transfer letter, discharge letter, and it can be a noun or known case. Referral letter, 100% unknown case, and other than this, one more letter I need to add this urgent letter. It can be unknown or known case. If the patient is urgently transferring to the new facility, it totally a known case. If the patient is transferring to the same facility for the further care and management as an immediate basis, so it can be a known case. So I hope all of you understand about the basics of OET writing, and it is very helpful for those who are started to learn OET and especially writing module. It is very helpful to set the base, and those who are practicing daily basis to write a letter and identifying different type of letter, it is very helpful for them also to identify whether it is a referral, transfer or discharge. And it is very helpful for them, those who are appearing exam on the upcoming week, to boost their base of OET writing letters. I hope all you understand about the OET writing module base, and we can upcome with another modules and another writing basics.